Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I will be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing this morning?
Doing just fine, thank you.
Dr. Murphy is the executive director of the Havey Institute for Global Health, as well as the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, studies, and U.S. COVID statistics through today, December 7th. We invite you to submit questions below via Facebook at NU Institute for Global Health or by emailing globalhealthinstitute@northwestern.edu. Starting with the U.S. COVID statistics. Average new hospitalizations per day last week, 2,777. In 2022, in the same week, we saw 3,780. Average COVID deaths per day last week were 137. In 2022, the same week, we saw 356. And the new vaccine uptake, which has been updated after the Thanksgiving holiday, adults are at 16%, among those 65 plus higher at 33.3%, and children the lowest at 6.9%. Dr. Murphy, your reactions to those numbers?
Yeah, well, they're going up. This is the respiratory season right now. We're in flu, respiratory syncytial virus, RSV may have peaked already, but there's still plenty of it floating around. So we've got flu, we've got COVID, we've got RSV all at the same time. This was expected. And this is going to go on for the next 3 months. So these numbers are up. There's no surprise. The death rate popped up. It's still much less than in 2022. So, you know, we're still have more herd immunity, and there are at least some people taking the vaccine. But remember, this last COVID vaccine is a new vaccine. It's geared toward the variant, that Omicron, that's floating around now. So it's really important to get it, but people are not taking it, or many people are not taking it. But yeah, this is here. If you're at all immunocompromised, if you're over 65 or 60, you should definitely keep up with your vaccines.
Absolutely. And there was new research, new study and survey data out of the Midwest and some surrounding states regarding plans for vaccinations. Can you tell us a little bit about that?
Yeah, kind of some disturbing information that came out of a poll from the University of New York Graduate School of Public Health and Policy. And they have surveyed people. Kaiser Family Foundation has done the same thing. And what stuck out with them was the intention to take the COVID vaccine if it was convenient and they could get it at no cost or whatever, was in the Midwest, only 43%. Or even have any intention of taking it. Now, fewer than half of that have actually taken it. Now, the national average is about 49%. So the Midwest is somewhat of an outlier. And it's not the worst. The worst is in Wyoming and Idaho, where only 26 to 32% of people are planning on taking the vaccines. And you know, at the end of the day, when you look at how many people die from these diseases or end up in the hospital, the states with the lowest vaccine rate always have the highest morbidity and mortality. So getting sick is morbidity, dying is mortality. So you get to pick which group you want to be in and take care of yourself and protect other people around you. But those are the data. It's really pretty disturbing because it's way off, and it's much less than with flu vaccine.
Mm-hmm. And moving into our next story, unfortunately, also about a lack of vaccinations, but on a global scale, there have been reports recently about, effects of the COVID pandemic on global vaccinations. Can you break down a little bit of that article, those numbers for us?
Yeah, COVID really disrupted the whole supply chain for vaccines and clinic attendance and staffing, and this is worldwide, you know. And that caused a big decrease in the overall immunization rate worldwide of everything: measles, mumps, rubella, you know, diphtheria, tetanus, all that, all the vaccines that kids normally get. And so the most recent data look like about 60 million children have been born globally who didn't get any vaccines at all. So they reported from 47 different countries, and they use measles as kind of a marker of all the other. If you didn't get measles, you didn't get anything, basically, is what it means. And you have to keep in mind, children are very vulnerable to diseases and dying. Nearly half of all deaths in children are from vaccine preventable illnesses. And in these never vaccinated kids, they are very, very high risk for getting a severe disease and dying. So you have to keep that in mind, which group you want to be in, or if you want to help. The group that delivers most of the vaccines globally to low and middle income countries is UNICEF. I think everybody has heard of UNICEF. And they have actually proposed a $350 million purchase of vaccines to try to fill in some of the gaps here in some of the places where the pediatric and childhood vaccines are unavailable. They want to close that gap. And the gap includes using measles as this example. 22 million children missed their routine vaccination. That was 2.7 million more than in 2019, and an additional 13.3 million didn't get the second dose. So the first dose works a little bit, but the second dose gets really high effect. And you've got herd immunity there is 95%. So you've got to have 95% who've had measles or have had the vaccine. So that's really high. So, you know, there is some light at the end of the tunnel in some of the high middle income countries like Brazil, Mexico, and Indonesia. Their systems have recovered from pretty much from the COVID disruption, and their rates are getting higher. So that's good news. So UNICEF is a great organization, and you know, it can really impact childhood survival.
Absolutely. And sticking on the topic of respiratory diseases and infections that affect children, we've been talking a lot about the monoclonal antibody treatment approved by the FDA for children under 8 months here in the US. However, as we've also talked about, there have been shortages of that treatment, and it's been very hard to find. Can you tell us a little bit about why and kind of the effects of this drug and RSV on children?
Yeah. Well, this is not a vaccine we're talking about. We're talking about a monoclonal antibody. The trade name is Beyfortus. It's a monoclonal antibody against respiratory syncytial virus, which is really deadly in young kids. So it's approved for use in kids from 1 week of age up to 8 months and up to 2 years if they're at risk. Now, it works really great. Keep in mind, RSV, respiratory syncytial virus, is the leading cause of hospitalization among infants in their first year. I mean, that's just a known fact. So if you want to decrease that, the leading cause of hospitalization, you have to take this drug. And there's not enough of it. In this case, there's a shortage. Now, keep in mind, there's 3.8 million kids born every year in the United States. And this drug is recommended for every one of those kids. All right. If every one of those kids got it, the hospitalization rate in children would go down a lot. According to the CDC, 2.1 million outpatient visits per year in kids were due to RSV infection. 56 or 58,000 to 80,000 hospitalizations in children under 5 were due to RSV, and 1 to 300 deaths in children 5 or younger. So if you want to basically wipe that out, bring it down to almost zero, you take this drug, but you can't even get the drug. The company, Sanofi, who's making it, they have delivered 77,000 additional doses, and that's great news. But, you know, we need millions of doses. So it's been very tough to get a hold of this drug, even if you can get it. It's been hard to pay for the drug, and for some people, because our insurance systems are, you know, they're very unequal. Then there's some pay, some don't pay. Out of pocket is $500. You know, most people cannot pay that. So, you know, it's a public health emergency in children, and it should be provided one way or the other if you want to deal with this problem. If you don't care
Absolutely.
that 60,000 kids a year end up in the hospital, or 300 of up to 300 of them die, that's, you know, that's the consequence that you pay when you don't take care of the public health of a country. So we have a great treatment to prevent it, and it's not being used optimally. So, you know, and it's not a vaccine. It's just an antibody. Plenty of antibodies out there. They don't hurt anybody. And, you know, it's kind of a sad story because we're so close to success. But hopefully, you know, this is a new drug, just came out. Hopefully by next year, we can figure out a better way to get this thing delivered everywhere, and especially to the most vulnerable kids.
Absolutely. And it's, you know, proven for those who have been able to get it to be a very successful and effective drug, as you mentioned. So we will, of course, keep you updated on any more news we hear about availability of the drug, where you can get it. Hopefully that will be announced soon. But sticking with RSV and also bringing it back to the big three respiratory illnesses that we see in these winter peaks, flu has been on the rise. As you mentioned, RSV may be peaking and COVID is doing its thing. Can you just go into a little bit about how the three big infectious respiratory diseases are interacting right now?
Well, they're just everywhere. This is the quote, the flu season, but now we know it's more than the flu. It's COVID, RSV, and there's a whole bunch of other ones. But the deadly ones are COVID and RSV, and then flu. So, and then these pneumonia outbreaks in kids that have been reported in Massachusetts and Ohio, you know, were first, oh, is this something new or whatever? But it turns out they've been looked at pretty closely, and there's nothing novel about them. They're all caused by known pathogens. The three we already mentioned, plus the other causes of pneumonia, Streptococcus, Mycoplasma pneumonia, these other ones that cause it. And they think that the reason why there's this bump up, and this is the same thing, what's going on in China, is that during COVID, when everybody was isolated, those nobody, adults and children, hardly anybody was getting anything other than COVID, if they even got COVID. So they didn't get exposed to all these other bacteria and viruses. And so they kind of lost the immunity, or didn't develop the immunity against those bacteria and viruses. So now that everybody's out and running around, traveling and everything, they're getting it like crazy. So there's this bump up, but it's nothing novel about it. It's just the same old stuff, but they hadn't seen it for a couple of years. So now you're seeing an increase in that. And it's really nothing more than that. Not that it's not serious, but there's no novel pathogen, no new virus or anything like that.
Which is very good news. And of course, we will keep eyes on whether any big news about these outbreaks does come out. But as for now, the CDC is reporting that these outbreaks are not outside the typical statistical ranges that we see here in the US for pneumonia. If that changes, of course, we will report on it here.
They're being investigated. Mm-hmm.
Mm-hmm. And moving on to another study, we've talked previously about reports of co-administering the COVID and flu vaccines, but another really great study just came out comparing co-administration, whether it's safe in adults for the flu and RSV vaccines. Can you tell us a little bit about that study and their findings?
Yeah, the first was COVID and flu vaccine. They said it was okay. And then in older people, there was more complications if they were given together, only in the older people that got the high dose flu vaccine. Not that nobody died from it or anything, but they were serious. And so a lot of people like to split those, especially in the older crowd. Because remember, in I think it's 65 years of age, you take 4 times the regular dose of the vaccine. So anyway, now a study was done looking at RSV and flu. Of course, it's very convenient. You got to take the day off and go get a vaccine to get 2 instead of 1, or, you know. So it's from a practical experience, it's easier to give 2. So the Australians did a study in 1,400 people, approximately. And they gave, it's a placebo-controlled study, so it's a really nice study. People are getting like both vaccines at once, or one vaccine and one like saline, just water. And so nobody knew who was getting what, and they reported all the side effects and whatever, and they didn't see any difference. So a beautiful controlled study showing that you can give it together and you don't have any more symptoms than you have taking one. So that's really great news. So you can take those together, because we weren't recommending that up until now. So now this has really changed. So remember, RSV vaccine is only approved for people 60 and over. What we were talking about before was the monoclonal antibody. That's a treatment, or preventive treatment. So this is different. So that's great news. It's very practical.
Absolutely. And it is to note, all of the participants in this study were in good health. As Dr. Murphy mentioned, they were above 65, so they were all eligible to receive this drug. So it's really great news, and something that you can factor in maybe in your next vaccine scheduling next year.
Yep, that's good news.
But kind of on a different note, and not great news, but climate change has been confirmed to be a major factor in the spreading of many diseases, including malaria, particularly mosquito-borne diseases. Can you tell us about that on the global scale?
Yeah, so malaria is deadly. It's the second leading killer of people from an infection other than tuberculosis. And it's sadly, it really affects kids under 5 years of age. Most of the deaths are in that group. The number of malaria cases which had been going down from all the efforts going around in the world. And there was a big bump up in cases in 2021. That's unfortunate. Most of these cases are in tropical and semi-tropical countries like Pakistan, Nigeria, Uganda, Ethiopia, and Papua New Guinea. And they're wondering, like, well, what's happening now? Why are the cases still going up? And they think it's due to the increase in flooding that has been attributed to climate change. You know, places that were drier are now wetter, and there's been a lot of flooding and whatever. Why is flooding important? Well, flooding, once the flood goes down, there's a lot of standing water, and that's the breeding ground for mosquitoes that carry malaria in these malaria-infested places. And so, and that's what's happening. It's really bad. Nigeria itself saw 1.3 million additional cases. You know, I mean, it's just, it's really astronomical. So that's unfortunate, but we're going to have to deal with that and focus our preventive efforts in the areas that are having these specific problems.
Absolutely. And moving back to, you mentioned this earlier about the respiratory illnesses, the quote unquote mystery illnesses that have been going off, spreading in northern China. There have been calls from some members of the US Senate to halt travel to China, both to and from, I should say. Can you tell us a little bit about that and reiterate again the findings that the WHO and CDC have publicized?
Yeah, so this has been followed for a couple months now, and there has been an uptick in cases they called white lung syndrome. I mentioned it earlier in Massachusetts and Ohio. Here in the United States, see the same thing. China, they're saying the same thing. Now, remember, China had a really, really severe and long lockdown. And nobody got anything during that period of time, no other diseases. And so now that things are open again, they're getting those diseases. And they've looked at them. WHO has confirmed them. And it's the same thing that we're seeing in Ohio and Massachusetts. It's the usual suspects that can cause pneumonia in kids, and doesn't look like any novel new pathogen or whatever. And people, these politicians don't trust the Chinese. There's some valid reasons to think that way, but the WHO has been in there, and they've looked at the cases and the documentation, and it looks like it's the same thing that's happening here in the US, and it's probably happening worldwide.
Absolutely, yeah.
The closer you look, the more you find. But it does not look like any new novel pathogen, and it's the usual stuff that's going on.
Mm-hmm. And of course, like the other stories we've mentioned, we will, of course, update you if we find any information contrary to that from reputable sources.
Yeah.
But moving on into our final story for today, we have a very interesting study in preprint. Dr. Murphy could explain what that means, but it is about a rare syndrome, very, very rare syndrome that's been reported after receiving COVID vaccinations. Could you please break that down for us, Dr. Murphy?
Yeah, so this is from the Yale University School of Medicine, team of researchers there, looking at a very rare syndrome of COVID-19 vaccination complications. So they got data, they received data from 241 participants who self-reported a post-vaccination syndrome. In other words, they got the vaccine, they got sick, and had symptoms for at least 2 months. And most commonly, they had exercise intolerance. They got tired when they exercised or tried to walk or whatever. They had excessive fatigue, numbness, brain fog, and neuropathy. They defined it as lasting for more than 2 months. Now, typically, you can have those symptoms with any vaccine that you take. And it usually goes away in a day or two, or at the most like a week. But if it persists, it's now this syndrome. Now this is self-reporting, so there's no denominator. So the denominator is somewhere between 676 million and 1 billion people, doses of vaccine have been given in the United States, so, and many more billions worldwide. So it's whatever the real true denominator of this survey and whatever, remains to be seen, but it's pretty rare. People tried all sorts of treatment, including oral steroids, gabapentin, naltrexone, ivermectin even. I'm sure that didn't work. Propranolol, bronchodilators, and sometimes the steroids work, sometimes not. There's no study, but anyhow, they're treated symptomatically, and in general, it goes away. But it lasts in these few people that get it, it lasts for several weeks or months.
Yes, and that's something that it is good to look into. These people were all vaccinated. They went in and tried to, protect themselves and those around them, and they should not be ignored if they're, having medical side effects and issues. So it's great that it is being looked into.
It brings up the whole point of cost-benefit analysis. In other words, okay, you've got 241 people out of how many? Maybe hundreds of millions have this syndrome. It's real. There's no doubt about it. But don't forget, 1.1 million people died of COVID. And whether you got it directly or indirectly doesn't really make too much difference. So you've always got to weigh the benefits against the risk. Nothing in life is really risk-free completely. But, you have to put the benefit in there too, to taking these vaccines. This is true for all vaccines. So, keep in mind how many vaccines have been delivered worldwide. It's really phenomenal, and they're incredibly well tolerated in general.
Very much so. And the preprint note about this paper meant that it has not yet been peer reviewed, so not, widely accepted or endorsed by the scientific community yet. Yeah. However, based on the, university institution and
what
researchers.
Katie is saying, but the way it works is, so that paper, they thought that information was so important, it should be released to the public before it gets printed in a medical journal. So that's what happened. So now at the journal they submitted it to, it will be reviewed by editors and referees, independent referees, medical doctors and experts in the field that will critically review it and recommend accepting it, rejecting it, or having it revised based on the problems that they see with the methodology or the reporting. Once that goes through, if they revise the paper according to those critiques, then a final paper comes out with the revised recommendations. Almost every paper that goes in gets some kind of revision before it gets published, or it just gets rejected. And then once it's in the public domain, there's still anybody from anywhere can comment on the paper, and they can write to the editor of that journal to say, well, I don't agree with this. Here's, anybody. And oftentimes, if the editor thinks it's justified, they'll send it to the authors to comment. So this is an ongoing process. So it's by the time it gets into print, it's been pretty thoroughly reviewed and revised, and it's a pretty clean piece of science that's out there. And still, you can comment. People can comment on it. So it's a whole scientific process.
Excellent. And thank you very much for breaking that down for us. I think we throw around peer review or printed or published.
All these things, no one knows what we're talking about. We have to explain exactly what we're doing. But it's a very thorough, rigorous scientific process that's been around for a long time. And it involves all of science. Everything is peer reviewed and has to be reproducible. And that's the way science works. Nothing's perfect, but it's about as good as it gets.
Right. And on that note, Dr. Murphy, I'd like to thank you for your time and expertise breaking down not only the COVID statistics, but all of these studies, the news stories, and the definitions for us. So thank you very much.
Good. Well, thanks very much.
And thank you all for joining us for another week of the Ask Dr. Murphy series. If you have any questions or comments, please leave them down below. We'll see you next week.
Have a great weekend.